With St. Louis County, Washington University's Institute of Public Health is teaming up with other local public health agencies to conduct a phone survey of 5,000 residents of St. Louis County. Participants will be selected in a statistically random way to make sure that we have a broad perspective of St. Louis County. Participants will be offered a free COVID-19 testing at locations throughout St. Louis County, regardless of whether or not they have symptoms. And they will be offered either diagnostic testing to determine whether or not they have the COVID-19 infection right now, or antibody testing to determine whether or not they may have been exposed in the past without having symptoms. Transportation to and from a testing location will be provided if it's needed. So this 30-minute phone survey will include questions about race, gender, and age, and other questions to determine how participants may have been affected by COVID-19. And all participants will be notified of their test results. Anyone who tests positive will be given thermometer, hand sanitizer, mask, and even a pulse oximeter to measure oxygen levels in their blood as they're recovering from the infection. And of course, medical personnel will be following up for anyone who may have had symptoms to make sure that they're recovering and moving forward. So this partnership will help us better determine the well-being of residents in our community, especially some who may have been infected without ever showing symptoms, but it will also help the County Department of Public Health guide our thinking and our policies moving forward as we try and respond to this pandemic. As I've been saying for months, in order to respond appropriately in our county, we need more testing. More testing even for people who aren't symptomatic, and it just has to be more accessible for everyone. The Washington University Institute of Public Health will be managing this study. They'll be collecting all of the data, and they'll be analyzing the data and then reporting back to our County Department of Public Health. Collaborators for this study include SSM Healthcare, BJC, Mercy Health, and of course our County Department of Public Health. So this is paid for, this study will be paid for through our CARES Act funding and will cost us almost $2 million. But it's important information to have to set our policy moving forward. In fact, the County Department of Public Health will be using this information to make several determinations, including the proportion of residents who may have been infected with COVID-19 without showing any symptoms, regardless of being tested in the past. It will help us understand the impact of the virus on the well-being of our county residents. It will help us understand the impact on racial disparities in our community. It will help us understand what risk factors are most commonly associated with COVID-19. It will also help us understand any preventative measures that we could be taking. So once the information from the survey is collected, the results will be made public, but we will not be making public any personal information of anyone who participated in the study. It's important to note, though, that this survey, this 5,000 person telephone survey in St. Louis County, is not related to any vaccine clinical trials. It's not related to any clinical trials of any medication. There are many of those tests going on in our community right now, but this is not connected to either one of those studies. So within a half an hour or so, the Washington University's Institute of Public Health and our St. Louis County Health Department will be releasing a press release, a press advisory of this study. More information will be available, and you can also find out more information at sdlcorona.com. Thank you, and I would be glad to answer any questions.
You said it was about 5,000 people?
Yes, 5,000 people in St. Louis County, a telephone survey. So if you are called, please participate in the survey. You'll be asked questions. Your information is confidential. This is a very professional operation through Washington University's Institute of Public Health. It's randomized, and as part of participating in the survey, you'll be offered a gift card and testing at any of our St. Louis County locations. The testing, of course, is voluntary. You do not have to take a test to participate in the survey.
And then you're confident that that sample size of 5,000 will be somewhat indicative of potentially trends in more county-wide speaking?
Right. 5,000 is a very good sample size that allows us to really drill down into demographic subgroups, and will give us a lot of statistically significant information, not just broadly, but for risk factors. It will give us demographic information specific to race and age and gender, and also location within St. Louis County. 5,000 is a good sample size to give us a lot of statistically significant detailed information.
Does it hinder the effort at all if people take the survey but then decline to get the test?
Well, it still gives us valuable information. We would like to have people take the test, but we think taking the test offers individuals valid information. Some people may be too busy to drive to a testing site to have the test performed, either a blood draw or a nasal swab. But we hope that many people will choose to participate in the testing, because it does help them as individuals, but it also helps our community and helps us make better policy moving forward.
Can you talk a little bit about youth sports a little bit? I know there's been the local sports medicine COVID-19 task force had said they believed as of Saturday they kind of rolled out their phase 2 of what they believe that should be, or what should be included in that. Does that run contrary to the county, or how do those mesh, or do they mesh when it comes to?
The county Department of Public Health sets public health rules and guidelines. We do look to the task force to help us determine what the right thing to do is. We've avoided referring it as 2 phases because this is all very gradual, but it was important to give high schools some guidance moving into fall sports. And these guidelines are detailed on our website at stlcorona.com, and I really would ask anyone who wants to know exactly what the guidelines are to look at our website and read them closely. But in general, it divides high frequency contact sports from low frequency contact sports. It makes it easier for youth to scrimmage in groups of 20 instead of groups of 10. It allows multiple groups on a field as long as they are separate from each other and not in contact with each other during their skills practices. It still does not allow for competitions or fans or team meetings or team social events or any of those events that we identified several weeks ago as high risk for our youth.
So does that, in your mind, open up the door a little bit to more practices and scrimmages as it relates to high school?
Yeah, we want to allow skill development to continue as much as possible and as safe as a manner as possible. And we believe that this advisory group, working closely with the Department of Public Health, has given the department some guidance, allowing us to work with our epidemiologists to expand the ability for kids to scrimmage, kids to practice, kids to continue to develop skills without any of the activities that are associated with the transmission of COVID that we've seen in youth sports across the country, that we've seen in professional sports across the country, that we recognize are a risk for our kids as they go back into school. But we do want to find a way for our youth sports to continue to develop skills, so folks can hold their level of ability, improve their abilities until we get to the other side of this and we can go back to competitions.
And is that effective today? That kind of expanded guidelines?
It's effective today.
Okay.
And those are available at stlcorona.com. I really would encourage all of our coaches, all of our youth sports coaches, all of our schools to download those and read them closely and let us know if you have any questions. But please don't accept any verbal description of those from me or especially anyone else. Read them closely. They're very detailed, and our Department of Public Health has worked very closely to develop those guidelines with interested parties, always keeping the health and welfare of our kids top of mind, but working very hard to recognize the importance of youth sports and allow those skills to continue to be developed.
My last question was, You had said it's probably about a month ago, especially I think when we started talking about the mask mandate, that really it takes 3 or 4 weeks for some kind of mandate to be in effect before we really see anything, just due to lag. So it's been more than a month that we've had the mask mandate in place, and I know it hasn't been too long with the whole bars closing at 10, but maybe on the mask front, what are we seeing? I know we're seeing higher numbers, but do you feel like it's working?
We're testing a lot more people. Our minimum testing goal was 1,500 a day. On average, we're testing about 2,800 a day. So we're almost twice what our testing goal was, and we will continue to do that. We'll continue to diversify our testing resources to try and maintain a large footprint there. We have seen the positivity rate tick down a little bit in the mid 8% range. I think that's important. We're watching the hospitalization data very closely with Dr. Garza's pandemic task force. Hospital admissions, ICU admissions, and ventilator usage. We're watching these numbers very closely. We have seen this the rate of increase flatten out again some, but it's still increasing. We really need to get widespread mask usage in St. Louis County. We really need to get it up to 90%, but we do believe that the public health measures that we have taken are starting to have an impact.
Where are we at if we're not at 90% mask wearing? Well,
the virus will continue to spread in the community until we get widespread mask using and acceptance of our social distancing orders. We don't believe we're there yet, just by observation. I think anyone walking around the community will recognize that. But when we get there, we will be in a much better place. It'll be safer for our kids. It will be safer for people in the community, and it will ease some of the pressure in our hospitals and make sure that people who need treatment for other medical conditions, strokes, heart attacks, others, will not be at risk for access to the hospital.
How far from that 90% rate do you think we are?
I can't give you that number. We're watching just like everyone, but we don't believe we're there yet. But we do believe we're headed in the right direction, and we can tell that by the flattening of the infection rate in our community. But we'll be watching it very closely, and we'll be watching hospital admissions very closely as well. Any other questions? I would like to remind our schools that today is the last day to apply for support for Chromebooks and hotspots. There's a link available at stlcorona.com, but we would encourage our schools who believe that they have students who need help help with technology that will allow all of our students to fully participate in virtual education, virtual classrooms this fall, until we can get back into a hybrid or a full in-class model. But we want to make sure that our school districts understand that today is the last day to apply for that support through the CARES Act fund, through St. Louis County, through our county libraries, and the link for that is available at stlcorona.com. Okay, thank you.
I'm not trying to bait you, ma'am. I'm just asking a question that seems
Ask
to
and answer.
address